Have you ever stopped to think about why we live so much longer than our ancestors did? Today, we're going to pull back the curtain on an invisible force that has gifted us something incredible: decades of extra life. This is the story of the unseen shield that protects us all, every single day, often without us even knowing it.
Let's just jump right in with a single, kind of mind-blowing number. Get this. During the 20th century, the average life expectancy here in the US shot up by over 30 years. I mean, just let that sink in for a second. 30 years. That is literally an entire extra adult lifetime that, say, our great-grandparents just didn't get.
Okay, so where did all that extra time come from? Now, if you're like me, your first guess is probably modern medicine, right? You know, doctors, amazing new drugs, high-tech hospitals, and yeah, that's part of the story, but it's a surprisingly small part. It only accounts for about 5 of those years. The other bar, that's where the real story is. A whopping 25 years, 5 times as much, came from something else entirely. And that is the mystery we're going to unpack right now.
So what is this powerful, almost invisible force that's responsible for those 25 extra years of life? Well, the answer, and really the hero of our story today, is a field called public health.
And to really get our heads around it, let's check out the classic definition. It's called the science and art of preventing disease, prolonging life, and promoting health, which, okay, makes sense. But here's the part you really got to pay attention to. Through organized community efforts. That phrase right there, that's the secret sauce. This isn't about one doctor treating one patient. It's about all of us, the whole community, working together.
And that right there is the absolute key to understanding this whole thing. I think the best way to really grasp what public health is to see what it isn't. So let's put it side by side with something we're all way more familiar with, regular old individual medicine.
This comparison really nails the difference, doesn't it? Think about it this way. Medicine is focused on treating you when you're already sick. It's like a doctor heroically pulling someone out of a dangerous river. Public health, on the other hand, goes upstream. It asks the bigger question, hey, why do people keep falling into this river in the first place? And then it focuses on fixing the broken bridge so nobody falls in to begin with. It is all about prevention on a huge, massive scale.
All right, so we've got a handle on what it is, but how does this unseen shield actually work? Like, what are the tools in the toolkit that made such a gigantic difference in our lives?
Well, here they are. These are the real unsung heroes behind that huge leap in how long we live. And it's stuff that seems so basic to us now that we barely even notice it, right? Things like a safe water supply, sanitary waste disposal, vaccination programs, better nutrition, safer housing in workplaces. These weren't just one-off treatments for a few people. These were massive, foundational changes that protected entire communities all at once.
And it's not like this is some one-and-done checklist. Nope. Public health is a constant cycle. It's always in motion. First, you figure out what a community actually needs. Then, you use that data to come up with smart policies. After that, you've got to make sure people can actually get to the services. And this part's crucial. You monitor everything, you research, and then you start the cycle all over again. It's a system that's always learning and always improving.
Underneath this whole process, there are a few core principles that guide all the work. It's built on ideas like health being a team sport, a collective responsibility, not just an individual race. And that relentless focus on fixing the bridge before people fall in, that has a name. It's called primary prevention. And everything, absolutely everything, is driven by hard evidence and data, and by working hand in hand with the actual communities being served. So it sounds pretty straightforward, doesn't it? You've got a clear process, a powerful toolkit, solid principles. So the job's done, right? We've solved it?
Well, not so fast. This is where things get tricky. We have to move from the clean, neat textbook theory to the messy reality of the street. And that's where we face the real-world challenge of actually putting these powerful ideas into practice.
And the core challenge, really, it all comes back to that big difference we talked about, the individual patient versus the entire population. See, a doctor treats one person at a time in a controlled clinic setting, but a public health worker, they have to deal with an entire community. And communities are messy, complex places, full of different beliefs, different behaviors, different histories. What works like a charm in one neighborhood might be a total flop just a few miles away.
What this all means is that success out in the real world requires a completely different set of skills. It's really less about lab coats and microscopes, and way more about things like patience and resilience. It's about being a fantastic communicator, understanding the political landscape, and maybe most important of all, it's about being present, actually being there and building trust within the community you're trying to help.
And this really brings us to the ultimate goal. Because when you boil it all down, public health isn't just about tacking on more years to our lives. The true mission is so much bigger. It's about striving for a state of complete physical, mental, and social well-being for everyone. It's about making sure that those extra years we get are good years for all of us.
So let's end with this thought. Public health is this amazing, invisible infrastructure that's keeping us safe every single day. It's in the clean water coming out of your tap, it's in the seatbelt laws on the road, it's in the food safety standards at your grocery store. You might not see the work happening, but its impact is absolutely everywhere. So the question I want to leave you with is this: what is the unseen shield protecting you from today?